Good afternoon. Welcome to the Understanding the Illinois Medicaid MCO Quality Report Card webinar. I'm Nadeen Israel. I'm the Director of Policy at the AIDS Foundation of Chicago, and I'm joined by
Kelsie Landers. I'm a policy analyst at EverThrive, Illinois.
And we're going to give it like a couple more minutes to give folks time to hop on before we get started. Thanks for those who are already on the webinar. Good afternoon. Welcome to the Understanding the Illinois Medicaid MCO Quality Report Card webinar. This webinar is being hosted by the AIDS Foundation of Chicago and EverThrive, Illinois. My name is Nadeen Israel, and I am the Director of Policy at the AIDS Foundation of Chicago, and I'm joined by
I'm Kelsie Landers. I'm a policy analyst at EverThrive, Illinois.
Thank you so much for jumping on, and we'll go ahead and get started. Next slide, please. So the objectives for this webinar are really to better understand the Illinois Medicaid MCO Quality Report Card, so kind of what it is, what its intended purpose is, potential uses for consumers, for advocates, providers, and other stakeholders. Next slide, please. And just as a quick reminder before we dive into the context for this topic, if you have any questions throughout the webinar, please put them in the chat box, and we'll do our best to get to as many of them as we can at the end of the conversation. And please keep the questions flowing throughout the webinar. So we thought we would start with a little bit of context behind how this consumer quality report card came to be. And so about a couple of years ago, House Bill 6213 was signed into law. It was on August 5th of 2016. So this bill was called the Empowering Meaningful Patient Choice in Medicaid Managed Care Act. And there were 6 provisions or 6 parts to the bill. The last provision of the bill, it actually starts on page at the bottom of page 13 and goes through page 18, is actually the provision that created the Medicaid MCO quality report card. So we've included some links here to the actual text of the law, to the consumer quality report card, as well as a fact sheet to the bill for those that are interested in looking at that after the webinar. Next slide, please. So for some more context on the bill and this law and how it came to be. The bill was really brought forward to improve the experience of Medicaid recipients when it comes to selecting and understanding their options specific to managed care. So the intended user of this report card was the consumer. So when we were writing the legislation and negotiating it with stakeholders, including HFS, the consumer, the Medicaid recipient, was really the intended end user in mind. However, there are lots of other stakeholders that can find benefit from digesting, understanding, and using the report card. The bill was also brought forward by many consumer health advocates. So we name a few organizations here that really work closely to, again, draft the legislation and advocate for and negotiate it. And that included the AIDS Foundation of Chicago, EverThrive, Illinois, the Shriver Center, Heartland Alliance, Chicago Coalition for the Homeless, and the Illinois Coalition for Immigrant and Refugee Rights, just to name a few. Next slide, please. And as I mentioned, the bill was heavily negotiated with HFS, with the Medicaid MCOs or managed care organizations, including the Illinois Medicaid MCO Association, IMHIP, providers that included the Illinois Health and Hospital Association, and many others. The end of the negotiation process was that all groups or stakeholders that had concerns with the bill ended up either being neutral or supportive of the bill. So at the end of the process, when the bill passed, there was no opposition, which is great. Next slide, please. So what are the specifics? What's in House Bill 5213? So what we're going to do over the next few minutes is my colleague Kelsie is going to go through the first 5 provisions that you see in front of you. So the provider directory, formulary transparency, grievance and appeals, Medicaid redetermination, Medicaid care coordination. And then the focus of this webinar, though, so we'll spend the majority of our time on that 6th provision, which is the report card. In the law, it's called the Consumer Quality Comparison Tool. Next slide, please.
All right, thanks so much, Nadeen. So let's start with provisions 1 and 2, the provider directory and formulary transparency pieces of the bill. So these are common sense feedback loops for consumers. First, provider directory. So the provider directory requires MCOs to, 1, have the provider directory on their website in machine readable format. The directory must be publicly available. It must comply with all federal and state statutes and regulations. And MCOs must request provider office hours for all of their different provider types. Another piece of this requires MCOs to confirm participation with contracted providers who haven't submitted claims to them within the last 6 months. This is to ensure provider information is up to date. It's really important to note that if providers are incorrectly listed on the directory and a patient receives care from that provider, patients are not held responsible for any costs resulting from the visit. MCO websites must conspicuously display email addresses and a toll-free number for patients to report directory inaccuracies, all of which MCOs must investigate to make corrections as necessary. The department must also regularly monitor Medicaid MCO entities to ensure compliance of these provisions. The second piece is formula transparency. So with this provision, MCOs are required to publish a formulary for each managed care plan offered and make the formularies easily understandable and publicly accessible in print and online. So the formularies need to include medications, both generic and name brand, which medications are preferred or not preferred by the MCO, what tier each medication is in, and the meaning of each tier. any information related to step therapy, prior approval, dosage limits, gender or age restrictions, or quantity limits, required cost sharing, a key or legend for all utilization controls on each page, and information about how to request more information. So these print and electronic formulary materials must include an email address and toll-free number for patients to call to report inaccuracies. And like with the provider directory, the MCOs must investigate and remedy any issues. The formulary info must include the date of publication, a statement that the formulary is up to date, and contact information for questions and requests. Client enrollment services brokers' websites must display a website URL link to each MCO plan formulary. So the next 3 provisions of the bill require the state to provide helpful information about who to contact and how to get help addressing issues. So the third is grievances and appeals. So the department must prominently display information about how an enrollee can file a complaint or grievance, request a hearing, and access free legal assistance. This information is included on the HFS website. The fourth piece is Medicaid redetermination. So the department shall require the client enrollment services broker to display on their website a description of where a Medicaid enrollee can access information regarding the Medicaid redetermination process. The fifth piece is the Medicaid care coordination. So client enrollment service brokers must display on their website consumer-oriented and easily understandable information about care coordination and the services it provides. This means that at a minimum, the information must include a basic description of care coordination and activities and how an enrollee can request care coordination. I'll pass it back to Nadeen to discuss Provision 6, the Medicaid MCO Quality Report Card.
Thanks, Kelsie. So as Kelsie just mentioned, the first 5 provisions of this law, we thought it would be important to just review them quickly to make sure that y'all know that they exist, first of all, and what they were meant to do. Again, all of these ideas were meant to help the consumer better understand, pick, and utilize their healthcare services when it comes to managed care. But like we said, the focus of this webinar is on that 6th provision, which created the Medicaid MCO report card. And what you're seeing in front of you, and what we'll walk through the rest of the webinar, are parts of the report card. So there's provisions related to the print version and the online version, and also process. So thinking about how HFS should go about both creating it and maintaining this report card. So it'll be helpful to have a visual for some folks who are more visually inclined. You can take a look at the report card that's in front of you right now. This is a sample for the plans that are, I believe this is across the state. And you can also pull it up online. So if you were just to Google Illinois HFS, on the home page, on the right-hand side, you'll see a link to the report card. So you can look at it that way and have it side by side as the webinar continues. Next slide, please. This next visual shows, so the first visual that was on the screen just before this one, if you can go back to it for a second, showed the kind of categories. So categories, you'll hear us say domain, are the things that say like doctors, communication, and patient engagement, access to care, women's health. Those are domains or categories, and that's how they're referenced in the law. And then you'll see that there's a key that shows the performance rating, kind of the overall performance rating for each MCO by stars. 1 star being the lowest performance, 5 stars being the highest performance, and about 3 being average. HFS actually also decided this year to include a column that showed the change from the last report card from the previous year. So it shows whether that MCO within that specific category improved, stayed the same, or performed lower year over year. Next slide, please. Thank you. You'll also see when you look at the kind of more full version of the report card online that there will be a section that shows the metrics, the performance measures or metrics that went into populating each category. So again, when I say category, I'm talking about, the example here is doctors' communication and patient engagement. The performance metric or measure is, the first one is adult, how well doctors communicate. The second one is child, how well doctors communicate. So these are different performance measures or metrics that went into populating the category of doctors' communication and patient engagement. And HFS was the one that ultimately decided which metrics or measures go into populating each broad category or domain. And so the online version of this tool, of this report card, allows you to be able to compare the different Medicaid MCOs, not only how they're doing within an overall category, but also how they're doing within specific metrics within each category. So it's a little bit more nuanced look at the Medicaid MCO's performance that's available online versus what is available in a print format. Next slide, please. Okay, so let's go in a little bit more into what's actually in the report card. So as I mentioned before, House Bill 6213 is the bill that became law that created this report card. The language on the report card, again, starts on the bottom of page 13 within the law and goes through the end, which is page 18. Some of the basics around what's in this part of the law, specific to the report card, is said that HFS shall create this report card and that it needs to be ready for consumers no later than January 1, 2018. As you might remember, the bill was signed into law in the summer of 2016. The reason why it was a delayed implementation was because, as part of the negotiation, HFS asked for a little bit more time to be able to kind of fully implement this version of the report card, and so that's where we landed. We landed with January 1, 2018. So this version of the report card that you're seeing and you have access to online in front of you is actually the first version that almost fully complies with House Bill 6213, with the provisions within House Bill 6213. The law also says that there has to be a print and online version of this report card, with the online version having more information, so a little bit more granular information than what the print version has. And a minute ago, I talked about a couple of examples of how the online version had more detailed information than the print version. The law also says that the print version, at minimum, has to be mailed to the Medicaid recipients during their MCO selection time, and when they're every year when they're able to renew, either stay within the same MCO or decide to change their mind and try out a different MCO. So anytime that Medicaid MCO packet gets mailed to the recipient, a print version of this report card, an updated one, needs to be in that packet. And that's already started happening, which is great. And then the report card, kind of as an overall frame, really is supposed to provide Medicaid MCO's plan performance on a set of standardized quality measures or metrics, performance metrics. Next slide, please.
All right. So as Nadeen mentioned, the law says that the Medicaid MCO's plan performances must display at least 4 categories. So these categories must reflect the plan quality, the timeliness, and access. These domains or categories are to draw from the following data sets, but also give the state some discretion to draw from additional data sets if they wish, as Nadeen mentioned. So they are required to draw from HEDIS measures, the core set of children's healthcare quality measures under CHIPRA, the adult core set measures, CAHPS survey results, and as I mentioned, additional performance measures HFS deems appropriate to populate the composite domain. So the report card must also use a quality rating system developed by the department that compares MCO performance with the national measures. We saw this a few slides ago when we had a screenshot of the actual report card. Our state currently uses stars to symbolize these categories. The print version of the report card must also be customized on the Medicaid recipient's geographic location. So when it's mailed out, it should be very specific to that consumer. Next slide. Additionally, the print and online versions of the report card need to include contact information for the Illinois Client Enrollment Services broker, which is currently Maximus, and information for contacting Medicaid MCOs that are available to the enrollee. One helpful part of this tool is the guided question section. So the report card must include guided questions designed to assist Medicaid recipients with selecting a Medicaid MCO. I'm gonna pass it back to you, Nadeen.
Thanks, Kelsie. So Kelsie just went through provisions or pieces that must be included in the report card, or kind of a frame in the law of how the report card should be laid out. These apply to both the print version and the online version. The next few bullets apply to the online version of the report card only. And the basic logic behind that is that they either, it would be more appropriate to be able to see these next few bullets available online versus on a print version that will go out of date fairly quickly, potentially. And also just in terms of updating and implementation, we thought these next few provisions through negotiation made more sense on the online version only. So that's why there's a little bit of a difference. So the first one is around more categories or more domains. So the law says that if HFS decides that more than 4 domains or categories would be good to show, would be good to display and provide to the consumer, to really anybody in the public, that they can do that on the online version. And again, because obviously with an online version, you're able to configure things differently, show them differently, the ability would be a little bit easier. At a minimum, though, the law says that there has to be 4 domains or categories are displayed. Another piece that's specific to the online version is about, again, displaying that granular level of information. So only the online version will have that performance metrics or measures that populate each category or domain. The print version, the kind of shorter version that the consumer would get, would just have the general overall score or star rating by category or domain. A third piece that the online version should have, although if you look right now, it's not fully actualized in what's available on the HFS website yet. We're hopeful that it will be for the next iteration of this report card. Is a sort function. So the idea was that on the online version, you really should be able to go through and almost like a drop-down menu, be able to sort and look at specific quality measures or metrics for within each category or domain, and be able to see the MCO's performance against one another, again, on that specific quality metric or measure. So while the information is available right now on the online version, it's just not available in a sort function. And the other kind of difference is that, or addition, sorry, is that the online version really should be in a place on the HFS website and on Maximus, on the Client Enrollment Services broker website. That's a prominent place and kind of easy to find sanction. So we know that Medicaid MCOs come under sanctions for lots of different reasons at various points in the year. And that's HFS's job to kind of determine that and work that out with the MCOs. What this law said is that if the MCO is under sanctions for something related to quality, to their quality performance, that information should be somehow reflected on the online version of the report card. And really the reason for that, again, is if we go back to the point of creating and having this report card available to consumers in the first place, is to allow them to have more information about the quality of the managed care companies that they are picking from. And so we thought sanctions, and if a managed care company was under sanction specific to quality, it would be important for that Medicaid recipient to have that information available to them when they're making it their decision about their plan. So that's why that provision ended up in there. And at the same time, when, sometimes within a couple months, sometimes within a couple weeks, the MCO is able to resolve whatever issues they had, and the sanctions are lifted. And so having this feature be only online would allow HSS the flexibility to kind of more real-time reflect the sanction information for each MCO. Next slide, please. So thinking about, we talked about kind of what's in the law specific to the report card, how it's laid out, what the thought process was as to like what information goes into populating the report card. This next piece, this slide, is about what's in the law when it comes to process and what process HSS should undertake or go through to both develop and update the report card moving forward. So obviously this report card has already been developed. What's in the law about the process is that HSS is really the agency in charge of laying out a frame for the process. And that frame should include establishing and publicizing a formal process to collect and consider both written and oral feedback from lots of different stakeholders. So consumers, advocates, other stakeholders, on aspects of the report card that include but aren't limited to the standardized data sets and surveys. So Kelsie mentioned CAPS, the adult core set, those are standardized data sets, HEDIS measures, the specific performance measures or quality metrics. So kind of like the well child visit is an example of a quality metric. And the composite domains or categories. So the first one that we had used as an example, I believe, was, something like, I know one of them is behavioral health. Mm-hmm. The second piece in terms of what should go into the information gathering for creating and updating this report card is the format and presentation. So that 5, 10, 15 years from now, there is continued feedback that HSS is soliciting as a Medicaid agency about what's the best way to present this information, again, with the consumer as the end user in mind. And the last piece related to this is around kind of the methods that HSS is taking to notify Medicaid recipients about the availability, the actual existence of this report card. So we talked about earlier in the webinar that at a minimum, HSS should be sending out, and right now this happens through Maximus, a copy of the print version of the report card when a Medicaid recipient has to pick a managed care entity or organization, and then when it's their renewal time for the same thing. So are there other ways and other methods that HSS should undertake to let consumers know and other stakeholders know that this report card exists, what it means, how it should be understood, etc. And then the law also lays out the process for updating the report card. So it says at minimum, HSS should be reviewing and updating the report card both against the composite domains or categories, the performance measures, again represented in both the print and online versions, at least once every 3 years. And it's only been a couple of years, but so far HSS has actually done this every year, which is great because we've already seen improvements every time there's been an updated version of the report card that's been more useful and helpful. And what we understand and what we've seen from last year is that HSS has chosen the Medicaid Advisory Committee, the MAC, the Quality Care Subcommittee specifically, to as a frame, as a space to both share updates and receive information and feedback specific to the report card. So our experience from last year was that this happened, the MAC Quality Care Subcommittee last year had 4 meetings, and so this conversation about the report card happened in the fall meeting. And so we haven't heard any updates on that yet. So unless we do, we're hopeful that we'll see something similar happen in the fall meeting of the MAC Quality Care subcommittee this year. Next slide, please.
All right, so thanks, Nadeen. Now that we've gone through each piece of the bill and the report card, it's really important for us to ask, what are the potential uses of this tool? So for Medicaid recipients, this tool will help with picking or renewing their Medicaid MCOs. Because the report card is broken down into categories, families with specific health needs can see which plan would be best suited for them. So for example, a family without children might not be as concerned with the services provided to young children and might instead care more about diabetes care, for example. The tool is helpful for advocates to better understand and be able to compare the Medicaid MCO performances against one another. And Medicaid MCOs can use the report card to set benchmarks, goals, and improve care, ultimately. HFS can also use the tool for the purpose of oversight and establishing goals. So there are many, many uses for this report card, and we're really excited to see it improved in the years to come. Next slide. So this slide just includes our contact information. Please don't ever hesitate to reach out with any questions or concerns. We'll now move on to the question part of the webinar, so please submit your questions in the chat box if you haven't already. We can move to the next slide too. Thank you.
So we've got a question about formularies specifically, that are managed care formularies. So the question is, can you speak about the MCO formularies? The formularies are often available, but many restrictions are not publicly available unless you're a provider with an MPI number. So we can certainly go into depth, a lot more depth on this question. I'm not sure that I fully understand it, honestly. When we've looked at, and we, at least at AFC, we actually look at Medicaid MCO formularies on a regular basis, specific to HIV medications and Hep C medications. And the layout and the overall kind of layout of these formularies are supposed to be so that there are like keys and a little bit of guidance as to how to digest them. So I'm not sure where the question specifically about having an MPI in order to be able to kind of digest more specific information within the formulary kind of refers to. But I would also encourage, and I'm sure y'all do this already, reaching out directly to managed care companies. I know HFS and IMHIP has put contact information for different departments within different managed care companies to reach out and ask if you're having a hard time understanding how to access a kind of the full version of a formulary. But from my experience, what I've seen online, either on the managed care company's website or on Maximus's website, we've been able to kind of digest the formularies, what's covered, what has prior authorization. And honestly, anytime we've had questions, we've reached out and asked and had conversations with MCO. So that's typically how we've handled it at AFC.
So our next question is, do we know the denominator of the number of people who completed these surveys? Is it a big sample size?
So that's a great question. So off the top of my head, no. But the thing to keep in mind is that the only kind of survey, at least that we know of, that this data is pulled from is the CAP survey. And I know that when HFS last year went through how they kind of determined how they got the data, basically, they did go more in depth into what the data that populated each of these categories. Unfortunately, I haven't found that PowerPoint on the HFS website after that MAC quality meeting. So I'm hopeful that this year we'll be able to see that PowerPoint after the meeting, after the fall meeting, on the HFS website, so we can better understand this piece of it. But I just wanted to kind of point out that the only like survey data that's in there is the CAPS one. The rest are more kind of quality metrics, so like I said, HEDIS measures, et cetera, that are populating the categories or domains. Did you have anything to add, Kelsie?
Yeah, I would just like to make another plug. If you're interested in asking these questions to MCO reps or just people who are really steeped into this work, I would really encourage attending the MAC Quality Care Subcommittee meetings in the coming months, just as an extra resource. We have another question. So how is access to care defined? Is it a measure of network adequacy, linkage, after referral, etc.?
That's another great question. So remember that the law just outlined like a framework for developing this report card and what should go into it. And it gave a lot of room for HFS to decide different aspects of the report card, including this one. So HFS, through an internal process, at least that's my understanding, decided that the measures that you see in the more detailed version of the report card under access to care, that those are the measures that are kind of used to populate the overall access to care category. So if you're wondering, well, what does access to care mean? Look to those more specific quality measures underneath it, and that's what HFS has used to determine the overall star rating for that specific category.
Our next question is, where can we find a link to each MCO metric? So I'm guessing just information or the metrics on the report card.
Yeah, so if you want to see the full version, both the like condensed print version and the more detailed online version, both are actually available online on the HFS website. The easiest way for me to get to the HFS website is usually just Googling HFS Illinois. So when that pulls up, the homepage will pull up. If you go to the right side of the page, I think it's like fifth, row down, you'll see Medicaid MCO report card or something that says report card in it, a link to that. And if you click on that, it'll take you directly to the most recent version of this report card, where you'll be able to see, again, both the categories or domains, but also the specific metrics within each category per MCO.
This next question is related to the grievances process, I believe. So does HFS take complaints into consideration when putting together the report card?
I'm not sure, to be honest. The complaints and grievance portion of the law was really our attempt at basically helping more consumers get to the fact that they have the right to complain, that they have the right to appeal and file a grievance. And so during the conversations about the bill, we wanted there to be more attention and more kind of that this information be more highlighted on places online where the consumer might go. So that's where the grievance and appeals part of the law, that's where it kind of came in. It ended up that there was more mention about it on the HFS website, and that there is a link to it on Maximus's website too. But how or if it's factored into the report card, I'm not sure. We haven't. It wasn't part of the law, at least.
The next question is: at some point, weren't all the formularies supposed to align to the fee-for-service / traditional formulary?
So align in the sense of, my understanding again of that is that they need to cover what fee-for-service covers, the managed care formularies, but that they are not bound by that they can go beyond. And again, our experience at ASP with HIV medication specifically is that many MCOs go above and beyond and are actually less restrictive than the fee-for-service formulary right now. So we are continually advocating for that to improve both on the MCO side and on the HFS side. But my understanding is that at a minimum, the Medicaid managed care formularies need to cover what the fee-for-service formulary covers.
The next question is, do you see any results from the ratings in regards towards improving insured care? Well, it's certainly the hope, but I'll let Nadeen jump in here.
Yeah, so that's a little bit harder to gauge. I think some of that will probably see, hopefully, reflected in the quality ratings over time. There was a great, I think it was the summer MAC quality meeting last year, where the MCOs or maybe it was the winter one, I can't remember. But there was one of the 4 meetings that happened last year, the MAC Quality Subcommittee meeting, where the MCOs actually each presented for a few minutes about kind of how they did with this report card for the year, and then what they're working on in terms of quality improvement. So I personally found that that meeting and those presentations really useful and helpful. Right now, I'm not remembering if they ended up on the HFS website or not, but the place to look for them is the MAC Quality Subcommittee meeting minutes for 2018. And again, I'm hopeful that we'll have something similar happen this year, sometime between the fall and the winter meetings, because I did think they were helpful in better understanding how the MCOs themselves are digesting this quality information and what their plans are to improve the quality for their members.
The next question is, how is the feedback scoring actually calculated? I see what the quality metrics are, but who is doing the scoring? Is this from consumers?
I'm not sure that I fully understand the feedback scoring piece. I guess one thing I'll say is that HFS contracts with a vendor whose name is escaping me right now, but they contract out with a vendor to kind of validate the data and do the calculation and inputting and creating of this report card. So it's actually the vendor that did the presentation last fall, so fall of last year, on this report card. Yeah, I'm not remembering who they are right now. But yeah, I apologize. I'm not sure that I fully understand that question.
What is HFS's response for those with low performance results and those with better performance results?
I'm going to look at that one more time. Can you read that one more time, Kelsie?
Yeah.
Sorry, I'm not finding it.
That's okay. So what is HFS's response, or how do they respond to low performance results or high performance results generally?
That's a great question. I actually personally have not heard a ton back from HFS, at least in a public setting, on their response to any of these outcomes. So I think that's a great question to put out to, again, in any kind of public or private setting. But I personally haven't heard anything specific outside of like they're always working towards holding Medicaid managed care companies kind of accountable to the outcomes that they're supposed to be providing and to improving quality. We also have to keep in mind that there are, I don't know kind of what the specifics are to this, but there are some financial incentives tied to performance when it comes to quality for managed care companies. So that's just something that I think that's important to keep in mind.
All right, so then there's some good questions. Let's just, one moment, let's scroll through here. I think we're on question 11, Nadeen, if you're looking. I'll read it out loud. So how are MCO programs that provide services to the Department of Rehab Services graded? We have numerous clients that are on the AIDS waiver program that have MCO case managers that aren't sure how to work with patients or provide the services. They aren't required to get certified as a DRS case manager and are often relying on the CBO case manager to do the work.
So that is a question that is very specific, and unfortunately, I don't know the answer to. I'm not sure. I'm assuming Kelsie.
I do not. The next question is also very specific, and I'm unsure if we'll be able to answer it, but I'll read it. Is there a way to find out which MCOs have providers that are most accessible for people with various types of disabilities? Is that a part of the quality measure for access to care? So maybe one provider has more doctors that are in wheelchair accessible facilities or provides ASL interpretation, etc., better than another one. These are major issues of quality for consumers with disabilities. If all of the other criteria is positive, but we can't get into the doctor's office or communicate with the doctor, that is a problem. Also, cultural competence is important for people of color and people with disabilities, LGBTQ people, and other marginalized communities.
Yeah, that's a great question, and I think both Kelsie and I couldn't agree with you more, whoever asked this question, in terms of this was kind of a first attempt at what we want to be seeing when it comes to the provider directory or formulary. And again, as a reminder, what we were able to kind of negotiate at the end of the day with the MCOs and with HFS. There's lots of room for improvement and growth, and I think this is an example specific to the provider directory that the questioner is pointing out. So I don't know of a feature right now in the provider directory that reflects accessibility, although my understanding is that they are supposed to be compliant and accessible, but I realize that even from personal experience that that's not always the case. So I think this is an area where continued advocacy with MCOs, but also with HFS is probably needed, and then potentially down the line, changes to this law and kind of improvements to this law might be needed to make it more useful to the consumer, to providers, to MCOs, and to other stakeholders. So I appreciate the question.
Yes, and it's very important for HFS and for MCO representatives to hear these concerns and policy recommendations or additions to the different tools that we discussed on this webinar. So I, again, encourage people to attend the public meetings or to reach out to your contacts to raise these issues because they're very, very important. That's all the questions.
I think that's all questions. So we will wrap it up and just say thank you again for joining us today for this webinar. It is recorded, so you'll get an email with the recording and the slides. And just as a kind of a final reminder that the quality report card really is one tool that we're hoping that the consumer will use to make a decision about which MCO, which managed care company is best fit for them. There are other things that if you are working with a consumer Medicaid recipient, that they also have access to, such as the provider directory, which of their providers or the providers that they want to access are in the provider directory, looking at the formulary and what's covered, is there prior authorization, etc. So there are other tools that should be used in order to make that decision, and this is just one of them, the quality report card. So thank you again, and have a wonderful rest of the afternoon.
Thanks, everybody.